Are you feeling pain inside the knee joint? So let's talk about two of the most common reasons why somebody is going to have pain on the inside of the knee. And we'll talk about what we can do to resolve that pain. So the first condition is called Pes Anserine Bursitis. And basically what happens is if we go just below the knee joint on the inside bony ridge, this is the tibial bone. That tibial bone comes up and it's got a large surface area on top. Right inside under that ridge, that's where the Pes Anserine bursa is. And what it is it's a fluid-filled sac that kind of provides cushioning, a little lubrication for multiple connections of other muscles, ligaments, tendons in that area. If I apply some pressure, usually with my thumb, into a Pes Anserine bursa and it's tender or inflamed, it will be painful. And so some of the best treatment strategies for a condition like this is a simple cross fiber massage. You can do it with the knee bent or you can do it with the knee straight. And so all I'm doing is I'm applying pressure. Now you can apply lotion so that your thumb can slide over the fibers. But in my clinic, I usually do this on dry skin so that I can apply enough pressure that the skin will stick to my thumb and I can mobilize the skin over the connective tissue below. So I'll do this 2 to 3 minutes, 3 to 4 times a day if this is something that I was dealing with for myself at home. You can apply ice cryotherapy. You can use ice massage, which is you take a small cup, you freeze an ice cube, you apply the ice cube on the area and you massage it for 3 to 4 minutes until you get a white area in the middle and then a red area around the outside. That works really well for pain management. But basically anything that can help facilitate the healing process will usually help to resolve the Pes Anserine bursitis medial knee pain. The other reason for inside of the knee pain is when there's a meniscus problem. Now, it could be a meniscus tear, it could be arthritis or degenerative changes. There's different reasons why your meniscus could become sensitized and inflamed. But basically what happens to find the meniscus is you would palpate as you flex and extend the knee, and you'll feel the bottom of the femur and the top of the tibia. That joint space, it's a little indentation. That is where the meniscus is. Now, while you can't palpate the inside meniscus, you can palpate the outside of the medial meniscus. And typically when there's a meniscus tear, there's going to be pain and sensitivity right on that joint line. The most common reason for a meniscus tear would be something that involved you stepping and twisting. There may be a sensation of clicking or popping. You might feel like the knee is catching. Those are all consistent with meniscus injuries. Now, unlike the Pes Anserine bursitis, where I can massage it and make it feel better, I can't really do that to the meniscus. The meniscus is a piece of cartilage that increases the surface area and shock absorption of the knee. Most of the meniscus is internal to the knee and I can't palpate it or manipulate it in any way. So the most common strategy for managing acute meniscus pain is to modify your activities. So either reduce some of the standing and twisting activities that could aggravate the meniscus. Maybe look at your footwear. I know that I've got an old history of meniscus damage and certain shoes will cause my meniscus to produce more pain than usual. You can look at some nutritional modifications. Now, I'm not going to give you advice on nutrition, but there are things you can do to reduce systemic inflammation and might help reduce some of the meniscus pain. And then, of course, consult with your physical therapist or orthopedic surgeon to see if the meniscus is actually stuck or flapped over. Sometimes you may need a meniscus surgery, but if you look at the clinical research, most meniscus tears can be treated without surgery in a conservative manner. So those are the two most common reasons somebody would have pain on the inside of the knee. If you're experiencing this kind of symptom, let me know down in the comments what you're doing about it and how you resolved your condition.